Welcome to another episode of Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The title of today's episode is Telling Tales About Plastic Surgery Telltales, How to Avoid the Done Look. Dr. Bass, most of us want to showcase our natural beauty and keep the details about how we got there to ourselves. We all hear stories about obvious examples of people who everyone can see has had plastic surgery. What are some of these telltale signs?
There's many to an experienced eye, but there are some that are obvious even to lay people. And if we start by thinking about the facelift, which is, in the view of many plastic surgeons, a much maligned procedure because of these telltales in some poorly executed examples. And so I want to emphasize at the outset that a lot of these things are associated with poorly performed procedures or procedures in individuals who have had way too much surgery, many surgeries. And so they're not routine results, but they're things that do call out that aesthetic surgery has been done. And our goal is for it to be something nobody knows. So in facelifting, of course, everyone always thinks first about the over-pulled look. And this can create a couple of different effects. Certainly, it can widen the appearance of the mouth and give sort of a Joker look. And another effect is to create something called sweep, a sweep or dip in the skin heading from the front of the face to the back. And this is more associated with some of the older techniques in facelifting, decades older, where the face was pulled much more in a back direction and was actually pulled, where tension in facelifts is something that's not used, and the direction of repositioning is more vertical in modern facelifts. Another area that creates telltales is the appearance of the ear. So sometimes the earlobe can be pulled down, and this creates a look called pixie ears. Not a very attractive look, and it gives away that lifting has been done. And the tragus, which is that little button-like protrusion right in the middle of the ear at the front, that can lose some of its delicacy or be distorted, or worse, be actually pulled forward, letting people look more directly into the ear hole, the auditory canal, rather than covering the auditory canal, creating a normal appearance. So those are a couple of common telltales in the facelift. Another is a posterior incision along the hairline, particularly if the scar is widened. So in a lot of lifting techniques nowadays, we can eliminate the posterior incision altogether, but in people who have advanced laxity, it's still necessary. And that can be fine along the hairline, but to avoid distorting the hairline and having a visible scar, the incision is often run straight back into the hair-bearing area, which conceals the incision. There are a couple of other effects with brow lifting, losing the natural shape of the brow, which should go sweep up, peak, and then dip in the outer third, getting a surprised look with the brow lift, or a more subtle change is a widening between the eyebrows in the glabello or central forehead area. So those are some examples with brow lifting. If we move down to the neck, sometimes there's too much fat removal, which skeletonizes the neck. or something called cobra neck. That area just under the chin can become concave if it's been excessively emptied, and it gives a very unattractive and not particularly youthful look that's sometimes called cobra neck. In rhinoplasty, there's something called the polybeak deformity, where the tip dips down off the top of the nose, and that's usually a sign that nasal surgery has been done. And alar retraction, a pulling up of the side of the nostrils, that also is a typical telltale that lets you know the nose has been operated on.
Wow, I didn't realize there were so many telltale signs when it comes to a facelift. How do they occur, and more importantly, how can we avoid them?
So sometimes we get unnatural looking things because too much surgery has been done, or surgery or some kind of treatments are being done too often, which traumatizes the tissues and creates some of the scarring and findings that make a visible telltale. Most often, it's probably the result of poorly executed procedures by someone who's either not experienced or not very artistic, because many of the telltales can be avoided and are really not a routine part of that particular aesthetic plastic surgery. So again, if we look at things like pixie ears and appearance of the tragus, I mean, this is all about trimming the skin appropriately so there's not an excess of tension that's going to distort the shape of the face. And the same thing with the overpulled look. When we look at brow lifting, I mean, the brow has a natural position, and bringing it to an over elevated position creates that startled or surprised look, which is very unnatural to walk around with all day, every day. So sometimes people are trying with a brow lift to take all of the slack in the upper lid skin out, and that's really a mistake. You should only bring the brow up to a natural position. If there's still excess skin in the upper lid, then you also need to perform an upper blepharoplasty to tailor out that excess skin, and not just keep pulling the brow up until it's in an unnaturally high position. Things like cobra neck, I mean, again, it's just a question of reducing excess fat and bulging in the neck, not cleaning out all the fat. You know, we're Americans, we hate fat, but fat helps create facial shape, and it also helps create body shape. It's just we don't want bulging fat, which creates undesired contours. So some people take the process to an extreme and just say, gee, if I can get more fat, it's better. Well, it's not better. It creates that cobra neck deformity, which is very unappealing. Rhinoplasty, some of the issues with nostril retraction relate to if surgery has been performed multiple times, but it also relates to some of the older incision techniques and older cartilage trimming techniques that were used decades back. Still people walking around having had rhinoplasties in their youth. That was decades ago. But with modern techniques, many of these things can be avoided.
That makes sense. So how can we pick a plastic surgeon who will give us the look that we want?
Well, I think a good way to figure that out is to have them show you some before and after images. So that's not a guarantee of the kind of result that you individually will get, but it gives you a good idea of what the surgeon thinks a good result is and what his or her style is like. So if you look at a picture and you say, gee, that doesn't look like a very good result, or that doesn't look very natural to me, or I don't want to look like that, then maybe that surgeon's style is not for you. And if you look and you think it looks great and the surgeon thinks it looks great, at least you know your approach and your stylistic aesthetics are reasonably well aligned.
That is a great tip. So far, we have only been talking about surgical telltales. I'm wondering, what about non-surgical treatments?
So, of course, there are telltales that we see passing us in a big city like New York City every day on the street, and all the non-surgical treatments are potentially subject to telltales again if the treatments are inartistically applied. Botox, of course, being the most common non-surgical aesthetic treatment, has a few of these. One is what in my generation was called the Spock eye, although increasingly people are calling it Cruella de Vil. It's an overarching of the outer part of the eyebrow. And fortunately, that's something that's very, very easy to treat by adding tiny additional amounts of Botox in the outer forehead area, and very easy to correct. Sometimes the forehead is treated for those transverse or side-to-side forehead lines, and smooths most of the forehead, but the very top of the forehead is still moving and wrinkles as someone talks or animates, and that's a telltale or giveaway that their forehead was Botoxed. Going to the other extreme, there's too much Botox. Some patients aren't happy unless they literally can't move anything in their upper face, and that gives them a mask-like look, which honestly is a little bit creepy. It's better to have some animation with a minimum of wrinkles, not to be completely adynamic, because we're supposed to be able to move our face. When it comes to filler, probably the number one area we see telltales is lips, where some folks are walking around with what I call the crazy lips. So they've gone way too big. It's obvious that they're not real or natural. And some other telltales are the upper lip being too big. The upper lip is supposed to be about 2/3 to 3/4 the size of the lower lip. The lower lip naturally is bigger in almost every human being. Also, the upper lip shape tapers as we come out to the corner of the lip. And when you see upper lips that are bigger on the sides than they are in the middle, you know that's a done lip. And both of these changes are sometimes called the trout pout. Sometimes also that edge area between the pink lip and the white lip, which is called the white roll or vermilion border, that was classically injected with collagen in the old days. When you over-inject that with today's fillers, you can get an over-accenting of the border of the lip, and it's kind of a duck-billed look that, again, most people would rather avoid, and is an obvious sign that your lip has been injected. In the face, people will inject the cheeks, and accenting the cheeks really looks spectacular. It's you, but it's beautiful you. But some people go too far, and they're trying to avoid doing surgical lifting by taking up slack in the skin, adding the additional volume of injected filler, and that's a mistake. And you wind up with a pillow face or balloon face by overfilling, and that's something that you can see coming half a block away on the sidewalk in Manhattan every day. So putting back volume to the extent that you've lost it is a really good idea, or modestly accenting shape to give a little more facial harmony, but just blowing the face up like a balloon to take laxity out of the skin is a big mistake. Sometimes laser treatments can create or chemical peels for that matter, can create a loss of pigment in the skin, kind of a porcelain-like skin. And skin naturally has some texture and has some pigment variation. So when you see that absolutely perfect skin, and sometimes it looks waxy or glass-like, and this is more of an issue historically than with modern laser peels and chemical peels, but that would be a telltale that the skin had been treated. And finally, people end up with a mismatch between their face, which again has beautiful skin, no age spots, no wrinkles, no laxity. Everything's been done to take care of the face. But the neck skin, the chest skin, the skin on the hands is stringy and has lost its elasticity and is crepey and covered with sunspots, medically what we call solar lentigos. And that's a giveaway that someone's really a lot older than their face would lead them to believe. And that mismatched look, again, is not very harmonious.
Can any of these telltales from non-surgical treatments be treated, or is it too late?
Well, a lot of them can. There are some treatments for hypopigmentation with lasers. It's a difficult problem, but we can make progress nowadays. Mismatch between the face and the neck, or the chest and hands, is easy to address by having some degree of treatment in these areas so that there's not so much discordance between the appearance of the face and the chest. Filler can be dissolved with the enzyme, and you can start over or just let the filler naturally absorb and come back and treat that more conservatively next time. As I mentioned, things like the Spock eye or the upper forehead still being animated are very easy to treat with small amounts of additional Botox. But if you create droopiness or that mask-like face, you have to wait for that to wear off.
We've been talking about the face mostly. What about the body?
So, of course, there are giveaways on the body as well as on the face. And probably one that's I think is a tough one has to do with the belly button, because when you do a full abdominoplasty or tummy tuck, there is an incision around the umbilicus or belly button. But sometimes that scar is always going to be visible. You know, if you go out in a two-piece bathing suit, that scar is going to show. Or people who wear, a sari or other traditional clothing that reveals the midriff of the body, that scar is going to show. Sometimes the scar is more visible than others. And we try to hide the scar inside the edge of the belly button rather than on the outside on the tummy skin. But sometimes the shape gives that away. It's a little too round. The umbilicus should be a little more vertical than side to side and have a little hooding superiorly. And sometimes some of these features are lost, or belly button that was an innie is flattened. It won't become an outie generally, but sometimes, especially in thin people, it can be flat. And this can be revised, or you can reconstruct the belly button and belly buttons that have really turned out poorly. And there are some techniques from South America and Brazil on belly button reconstruction when this happens. Looking at other body shaping, probably the big one right now is Brazilian butt lift, basically fat grafting to the buttocks that's overdone. It's always important to be proportional and have harmonious shapes. So when you see someone with a tiny waist and a really big protruding or shelf-like butt, that's telling you that something unnatural was done, and some of the folks doing that don't mind that it looks unnatural. They like the look. But if you're trying to look natural but just have more curviness there, keeping it in range is a good idea. It just means not overdoing it. Same idea with breast implants. Somebody who's very petite and very slender with huge breasts that are way out of proportion to their body is projecting a fairly unnatural look. Another area where in body contouring that can show is the technique of ab etching. This is where fat is very thoroughly removed in certain areas to mimic the tendinous inscriptions that give us a six-pack in our abdomen, and leave fat in between. So natural tendinous inscriptions, a natural six-pack is not perfectly symmetric. It's not super sharply defined, and the leaving the fat can, if it's done in too pronounced a fashion, can look overly puffy. So again, by balancing the technique, you can avoid an unnatural look by trying not to go too extreme. There are a whole host of unnatural telltales with breast implants. People with a great deal of upper pole fullness or a very defined edge to the implant all the way around make it pretty obvious that the patient has had a breast augmentation with breast implants in. Sometimes very slender patients who have no baseline breast tissue and very little body fat will get a sort of egg on a skillet look with the breast implant, which again is not incredibly natural given how thin they are. That may be the best that can be done, and it gives them more of a female breast contour, but it usually will not show perfectly natural. And one of the most vexing problems is when the implant has rippling, particularly at the outer edge. So someone will be out in a bikini or a low-cut dress, and they will show rippling in the implant, which is an obvious unnatural finding and can sometimes be difficult to correct.
Lastly, before we conclude, Dr. Bass, can you share some important takeaways for our listeners about how to avoid the done look?
Absolutely. Everything in plastic surgery is about creating balance and proportion, basically harmony. Harmony is beautiful. That creates a natural look, not an extreme look. Now, some people are trying to create an extreme look and they're willing to accept not looking natural. But again, they're going to be walking around with telltales that they've had plastic surgery and that their appearance is manufactured. Most patients, particularly where I practice in the northeastern United States, are really not sharing that they've done surgery with more than a few very close friends and family members. And so they'd like to look natural. So nuance is how procedures are done, and paying attention to the fine details. When I'm doing a facelift, I'm worried about getting a sharp jawline and a very clean neck, but I have to think about making sure the earlobes are exactly positioned correctly, that the tragus is very precisely tailored, sutured, and inset so that it preserves a natural look. These are all critical to maintaining that natural appearance, not just getting a big removal of skin or a big pull on the face and neck. Probably the most important takeaway is to use each technique for what it's good at doing and for the degree of correction that it's well able to produce. When we take a modality and push it as hard as we can, that's when we land up with complications and distortion and unnatural changes in appearance. A lot of times, we do have good options to improve things if they don't turn out natural, if we have some kind of telltale. Sometimes we have to wait till there's some healing and settling time, scar maturation, or more time passing so that we can rework the area. But it's very hard to completely undo some of the surgical telltales. So preventing and avoiding those problems is always the best approach.
Thank you, Dr. Bass, for sharing your insight and expertise with us. And thank you to our listeners for joining us today to hear about telltales in plastic surgery and tips on how to avoid them. I hope you found this episode as fascinating and informative as I did. If you think of other exciting developments or trends in plastic surgery that you would like us to discuss in upcoming episodes, please reach out via email or Instagram. We'll see you next time. This is Doreen Wu, thanking you for joining Dr. Bass and me for this discussion of telltales in plastic surgery. Be sure to tune in next time, and don't forget to subscribe to our podcast to stay up to date with all of the exciting content that is coming your way.
Thank you for joining us in this episode of the Park Avenue Plastic Surgery Class podcast with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The commentary in this podcast represents opinion. This podcast does not present medical advice, but rather general information about plastic surgery that does not necessarily relate to the specific conditions of any individual patient. No doctor-patient relationship is established by listening to or participating in this podcast. Consult your physician to advise you about your individual healthcare. If you enjoyed this episode, please share it with your friends, and be sure to subscribe to our podcast on Apple Podcasts, Google, Spotify, Stitcher, or wherever you listen to podcasts.